Good afternoon. My name is Carrie Anderson. This week we explored the areas of mobile health and mobile technology, which is an exciting new chapter in healthcare. This is because the technology that has been developed and continues to be developed has the ability to help improve individuals' health and to be leveraged in order to improve health outcomes by expanding where and to whom healthcare can be delivered. In my personal life, I utilize a health app called Fast Metabolism Diet that coincides with an eating and exercise program that I have been on for the past year. The application provides me on-the-go information regarding the plan, and it costs only $2.99. The app allows me to track my food, exercise, and water intake. As the application's description in iTunes indicates, tailor your meals and meal times to fit your tastes, restrictions, and lifestyles, all of which you are able to do with this app, which is great for me with being a part-time student, working full-time, and my busy family life full of obligations. It's nice to have something that makes my life easier while improving my health. The cost seems so minimal of what has helped me to accomplish. It has helped me not only to lose weight, but feel better, have more energy, and sleep better, all for a nominal fee. And I'm sure it has helped others too, which is important in this modern world as chronic health conditions such as obesity and diabetes are on the rise. This is in contrast with applications I use on a daily basis in my job as a claims adjuster. In handling claims, we use multiple programs to help predict and reserve for the treatment and costs associated with a variety of injuries. We have a claims dashboard, which is part of our claims management system Express, which provides an injured worker's demographics such as age and life expectancy, and also trends and current use of items such as medication to help us get an overview of past treatments on the file in a snapshot view. We also have MD guidelines that allows us to research specific injuries and review what the normal treatment protocols according to evidence-based medicine. It also provides recovery times for post-surgery and allows those times to be adjusted according to comorbidities such as obesity, smoking, and age. In order to properly manage the file, including approving treatment requests and reserving the file for the costs associated with care, we may have to access a variety of other web-based portals, including those of our DME management system and pharmacy management system. While we have many resources that we have access to in order to assist us with our jobs, the most frustrating aspect is how fragmented the systems are. Information is contained in a variety of places. While the data and resources are there, they are not contained in one easily accessible system and require moving between multiple systems and dashboards daily. It creates additional time to do this, along with the re-entering of information to properly document and request items. This highlights one of the struggles facing health information technology: how to best use all the data that is contained in the healthcare system. In their report, Transforming Healthcare Through Secondary Use of Health Data, PricewaterhouseCoopers addresses not only what secondary data is, but also the successes that some organizations are having harvesting and analyzing the data, along with the barriers to its use. Their report defines secondary data as clinical, financial, administrative, and self-reported data, which is aggregated, analyzed, and presented in a concise, actionable format for the purpose of identifying trends, predicting outcomes, and influencing patient care, drug development, and therapy choices. Secondary data use ranges from reviewing clinical outcomes for quality standards to selling data for treatment studies. Just like the sources of healthcare data is widespread, the use of it spans the entire healthcare industry. PricewaterhouseCoopers did outline some specific healthcare entities that are successfully utilizing secondary data. For example, Aetna is using data to enhance care to its patients by comparing medical data received from multiple sources against evidence-based medicine in order to ensure there are no preventable gaps in treatment. Secondary data can also be used in pharmacy and treatment research by providing broader information regarding medical conditions and the patients that are diagnosed with them. The Geisinger Health System is the focus of many articles as they have created a company, MedMining, which allows for the research to be done by selling data which has been de-identified. The Healthcare Financial Management Association published an article by Daniel Garrett that not only discussed MedMoney, but also that of GE Healthcare, which partner with the CDC to provide de-identified data regarding the flu and outbreaks nationwide. This helped to better understand the spread of this disease and who the most vulnerable in society is. The examples go on, but this is just the beginning of what data can be utilized for. There are so many challenges regarding that and utilizing the data meaningful. The standardization and interoperability of data so that it can be shared and used is an issue which is still being discussed, with various means of implementing programs designed to address these issues emerging. This is important as we need to ensure the integrity and reliability of the data that we use. This is especially important if we are using it to suggest improvements in quality standards, evidence-based medicine, and research for future treatment regimens. Security, especially protecting individuals' personal information, is important, and there needs to be specific guidelines in place and the ability to delink medical conditions and treatments to specific individuals, not only because it's the right thing to do, but because it is mandated by HIPAA requirements for specific entities. The potential for the usability of secondary data is unlimited as long as it is used appropriately and within its limitations. Thank you.